Welcome on behalf of the members of New Jersey Legislative Black Caucus, from Trenton to you. I'm your host, New Jersey State Senator Ronald L. Rice, and Chairman of New Jersey Legislative Black Caucus. You know, throughout the years, we hear a lot about national organizations, international organizations, and local organizations. And one of the organizations we hear a lot about is the Red Cross. Another organization we have heard much about in the past, and we associated with polio, that's doing a lot more than just addressing the issue of polio, which is somewhat under control these days, and that is the March of Dimes. Interesting enough, I had the occasion to talk with members of the March of Dimes, and I was really somewhat elated with all the kinds of things they are doing, not just throughout the international community or the national community, but right here in New Jersey itself. A lot of information, the data that we get relating to legislation, things that need to be done, relating to young people and others, is actually coming in from the March of Dimes and the kinds of work that they do. And so today I'm very pleased to bring to you, our viewers who are listening in and watching today, a young lady who is the Associate Director of Program for the March of Dimes, one who lives nearby here in the New Jersey area, and one I think that going to give you a lot of information that you never thought that the March of Dimes would be providing or is providing to those of us throughout the state as well as throughout the country. And so I want to welcome today Ms. Kristen Henry and say thank you for coming on our show. And as I was saying to our viewers, I'm really kind of, shocked, because I get data relating to young people and how we are doing and things like that, but traditionally it's coming from Citizen Action or the Advocates for Children, or like I said, if it's disastrous stuff, Red Cross. But March of Dimes, I just thought 10 cents in a thing and polio, 10 cents in a box and polio. So why don't you tell us something about Kristen Henry, and we're going to talk about the March of Dimes as well.
Thank you, Senator, and I'm so thrilled to be here today to really talk about what we're doing. So I was born and raised in New Jersey, grew up in Hudson County. I went to high school in North Bergen at High Tech High School. I went to Seton Hall for my undergraduate degree in biology, and then just recently a Master's of Public Health from Montclair State. Now I find myself working with the March of Dimes, an organization that I'm incredibly passionate about, and I'm really excited to tell New Jersey more about.
Well, I'd like, know that you've come up in our community, and I know that you live in a nearby town where we're taping today. But I want to know more about the March of Dimes. Tell us about the March of Dimes. First of all, tell people, because, young people, it's very interesting, may not know about the March of Dimes at all. My generation and generations that have actually come behind me, we used to hear the March of Dimes, March of Dimes, March of Dimes. Any store we went into, we could probably see some advertisement of the March of Dimes asking for assistance and donations and contributions. But like I said, we always associated it with polio or someone that had that type of a handicap. So for our viewers, other than hearing the word March of Dimes, because people say, oh, I know what that is. No, that's what you heard. You don't really know what it is. Tell us exactly what is the March of Dimes organization, and maybe some history, if you have some history you can give us.
Yeah, absolutely. And you're not the only one that thinks that way about thinking of polio or not necessarily knowing exactly what the March of Dimes does. We hear all the time, great, March of Dimes, tell me more. So a little bit of background for those who don't know. In 1938, Franklin Roosevelt started his campaign to find a cure for polio. And that's how the March of Dimes started. And they worked really hard raising money and looking for a cure. And Drs. Jonas Salk and Albert Sabin did come up with a vaccine for polio, and that really helped to end this epidemic of polio in the United States and around the world. And now everyone is vaccinated for polio. We don't hear about it, we don't really see it, and that's all because of the work of Franklin Roosevelt. And after they came up with this vaccine, they started seeing the numbers decrease. They said, well, we're not going to disband this incredibly successful group that we've created here. Now let's do something more. And so they changed their focus to birth defects, infant mortality, and premature birth. And so we're seeing kind of over and over again all these problems that we can address that are really affecting infants and children. and things like our folic acid campaign, which was very recent, which helped to decrease the number of neural tube defects, so birth defects that are affecting the brain and the spine. So all of those things are research and innovations that the March of Dimes has really championed over the years.
So then exactly, it appears as though the March of Dimes had one purpose and one mission, almost in isolation back then, that was very necessary, by the way. But because of the intellect, if you will, and the skill set and the compassion and all the other things that go with that, it was really thought, and a good thought as well, to keep the organization active and visible. And so I would suspect that the mission probably came from the foundation of the March of Dimes, but it's somewhat changed. Exactly what is the mission of the March of Dimes as it exists today?
So the March of Dimes wants to improve the health of infants and children by working with prevention and treatment of birth defects, of infant mortality, and of prematurity. So really getting into what are the risk factors, what causes these things, and what can we do about them. And since 2003, one of our big landmarks has been our prematurity campaign. So really focusing on that.
Sure, we're going to talk about that. But I want to go back to its inception or its beginning, the March of Dimes. Now, when you talk about polio, because now you're talking about a mission dealing with infants, was the polio directed towards infants? In other words, was it something after the fact or something before it occurred? Was that an infant thing that it was looked at from birth on, or was it something that after a youngster, a baby was born and they realized they had polio, it was looked at? I mean, how did that work initially?
So polio is often a childhood disorder.
Okay.
And President Roosevelt had a personal experience with polio, which is really where it started from, and seeing how many children were really being affected. And what they found is that immunization as early on as possible prevented the polio from developing later.
So, all right, so technically then the March of Dimes has always had this relationship with infants prior to birth and after birth and as they go into adulthood. So it's only natural that today they would still be dealing with prematurity and infancy and things of that magnitude. Okay, so if that's the case, then let's talk about the prematurity, some of the problems with prematurity. Let our viewers know just what's on your mind about those kinds of issues. Okay.
Yeah, and this is something that we really still need to wrap our heads around and start to understand better. But for about 30 years, the number of premature infants in the country was steadily increasing. We were the #1 industrialized nation for prematurity and infant mortality. And that seems a little crazy. We think we're so far ahead in so many other things, but we really couldn't wrap our heads around what to do about these issues. And so in 2003, the March of Dimes decided to start their prematurity campaign. And at that point, 1 in 8 babies was born premature. And so hundreds and thousands of babies every year were being born premature. It's the #1 cause of infant death and lifelong health disorders, problems with brains, with lungs, with hearts. All of these things happen because of prematurity. In terms of the fiscal problem, a preterm baby can cost up to 12 times more than a full-term baby at birth. So the problems are really at extreme for a preterm birth. And now our numbers are at 1 in 10, so we're definitely getting better, but the numbers are still too high, and our goal is to get down to 8.1% by 2020. But we're working every day to figure out what are the risk factors, what can we do to really help to decrease the number.
When we're looking at risk factors, the question, are we looking at causation? Risk and causation sometimes get confused. And the question is, are we starting to identify the causes of all this prematurity? And is it different in different ethnic groups? Or, can you talk about that a little bit?
Yeah, absolutely. So prematurity doesn't affect all communities equally. And that's one of the big things that we're looking at. So in New Jersey, we see a pretty significant difference between black and white, between Hispanic and white, between black and Hispanic. There are no ethnic groups in New Jersey that have the same rates in prematurity. So black and African American women have 2 times the chance of having a premature baby and 3 times the chance of experiencing infant mortality. So this is a huge difference. And so in New Jersey, the numbers, it's about a 5% difference between black families and their white counterparts in prematurity, and about a 7% difference in infant mortality. So the numbers are staggering when you think about how many families and how many babies this is affecting.
Do we have numbers on the Latino community, the Hispanic community?
So the Hispanic and Latino community fall somewhere in between the two. They're still above their white counterparts, but their numbers are not as high as in the black community. And something that we've seen too is that the Asian community is even lower than the white community. So we're trying to look at, is this social? Is this economic? Is this biological? So really looking at why. Why do we see such a big difference?
Yeah, because if you look at it from an economic perspective, then we can argue that the Asian community, for some reason, have a lot of wealth. They come to the country wealth, they build wealth, etc. But so does the white community, have a lot of wealth. That's where the wealth kind of exists in this country, in those kind of types of communities. So, you said, well, it may not be wealth, because that kind of play its way out to some degree. So then you have to look, I suspect we would have to look at, okay, where in the wealth population, or where in the Asian population and the white population, demographically where people are living, where do we find the most of this? Is it where the diversity is great, where you have a stronger diversity community of quote unquote whites, Asians, Latinos, and African Americans, or a combination of those? Or are we getting the same type of numbers, if you will, particularly on a racial basis, in strong, predominantly white communities and Asian communities? Is that being looked at that way and trying to be broken down to more definitive type of numbers and et cetera?
Yeah, and there's so much that's being done right now. Mm-hmm. So we are definitely looking at what the communities look like.
Yes.
And looking at what's available in the communities, what's access to care like in the communities,
okay.
What other factors are really affecting your whole life course. So it's not just one thing that happens at one time. So really looking at factors from the beginning on. There's some really great research being done looking at more of a biological level at one of our prematurity research centers that the March of Dimes has funded. And they're looking at biological differences between different races and ethnicities to see, is there something here? Is there something that's causing this huge difference in the numbers? So that's being done on a biological level. And then there are a whole array of different programs that we're looking more on the social level. So
are these numbers in perspective across the country? Are the numbers you've given me in terms of the gap, if you will, are they New Jersey numbers, or are these numbers reflected nationally with the Asians and the white community, the black community, Latino community? Are they pretty much the same numbers throughout the country?
So the difference and the disparity is very similar. We see a very similar trend throughout the states and the whole country. Some states have much higher rates of preterm birth and some states have lower. So it really does fluctuate, and New Jersey falls somewhere in the middle in terms of our progress towards reaching our goal. But the disparity, like that difference between white, black, Hispanic, it's fairly similar throughout the country. So we're seeing that everywhere.
Even in those areas where there's a lot more prematurity rates, birth rates, higher birth, but the disparity is there. It's still, if it's higher, it's still the same thing. The numbers still kind of pad out in terms of the different gaps of the different ethnic groups.
Yeah, for the most part, you see a heightened rate for the black community.
Regardless.
Yeah.
Okay, yeah, so we have to look at the genes, but we also have to look at where we're living, and we have to look at environmental issues. One thing we do know is definitely look at environmental factors. There's a great impact on immigrants' population as well as the black community because of old industrial cities and counties where you've had, and still have in some cases, your manufacturing plants, your chemical industries, and all those things that are impacting the air quality as well as the water quality in those communities that we're not even aware of, And so, can you tell me what is being done to try to close this gap since we know it's there? We also know there's a lot of research that is taking place, a lot of research that has been done, and a lot more research that need to be done. But given what we have and what we know, what is being done to close the gap besides the research?
So there are a few things. So I'll tell you about a program that the March of Dimes really championed in California, and then I'll tell you a little bit about what we're doing here. So in California, they had legislation and funding passed for what's called the Black Infant Health Project. Okay. And what that does is that provides resources and services to any family that needs it in certain communities in California. So whether it be group care, group sessions where families can get together and talk about what their needs are, connecting them to housing resources, to resources for better nutrition. So all of these different things, and they found that it did help to reduce those numbers. And so we're doing a lot of similar things. We want to help to increase the access to care, which is the first thing. So one of the things that we know and that the research supports is that early entry into prenatal care really helps to decrease that preterm birth risk. So getting women to see a doctor in the first 3 months of their pregnancy is really important. So one of the things that the March of Dimes was able to do specifically in the greater Newark area was we started working with people in the community and working with the health clinics and with the hospitals. And the team went into one of the hospitals and said, how long is the wait for someone to get an appointment for a pregnancy test? And the response was 8 months. At that point, we're already having our babies. So what we were able to do in the time that we've been working in this community is to now get same-day appointments where you can walk in and you can get a pregnancy test and you can get set up with your prenatal visit. They'll help you enroll in Medicaid if you're eligible for that. They'll help to find how you can make your way to and from your appointments. They'll help you with your transportation routes. So all of these things that we see as barriers to care, we've been able to try and help to solve those. So that helps in one aspect of getting people into care. So if they have any risk factors, we can help to manage them from the beginning. So that's one of the big things. One of the other things is we started our Healthy Babies Are Worth the Wait program. So that's really been a comprehensive look at what can we do. So really getting groups together, encouraging this community mentality so that women who are pregnant can help to support each other. And that's one of the big things that we found has been really helpful in encouraging positive birth outcomes. It's just a whole system of positivity.
Well, in New Jersey, let me ask you a question before I talk about New Jersey, because I love my state, but I get upset with the politics of this state and the confusion that we create collectively as elected officials with the public, which create this divide when it comes to needs, economic justice, and how to treat people fairly and provide what's needed, not what's wanted. But before I do that, are the states that's having these kinds of problems like California, are they doing much more or doing a better job than we are in New Jersey in terms of accepting some of the realities that the March of Dimes and others providing as to some of the elements and variables we see that are problematic, such as housing and healthcare, like you said, getting to the doctor early, transportation and stuff like that? Are they doing a better job in paying attention to it and trying to seriously, collectively, without all the politics, do something about it?
So I can't say for sure. I don't know how the politics work in a lot of the other states. But what I will say is there are plenty of states that are struggling with the same issues that we're struggling with. So there are communities in, I would say, each and every state that struggle. So it's really about opening our eyes to those communities and saying there's something that needs to be done here.
Well, the reason I raised it is because as Legislative Black Caucus members, every time we raise the issue for all people, but we're talking about areas that are predominant minorities, but we have diversity. Our diversity of quote-unquote whites, oftentimes for middle class, low-income wage earners. If it's Asians, same thing basically. And then there's other immigrant populations. So when we start to talk about that, look, the quality of housing, we got to fix that. We have to hold landlords accountable. We have to clean the paint up. For lead paint, for example, we put in money, the governor put the money in the general budget revenues for cleanup. Then they sell to other parts of the states who are doing a lot better, who may not have the same kinds of problems. Well, they're just crying all the time. They just want entitlements. They think they're entitled to everything. And so I get the impression that the realities never set in with the legislatures, that these are real needs. You know, we can lay blame all over the place, but regardless of who's at fault, we'll have to address these kinds of problems. We have to find a way to get primary physicians in these communities, healthcare centers in these communities that are affordable, okay? Message out to the public as to how to get to the health care. We don't bicker over affordable care. If it makes sense to have that and something else to go with it, you know, what difference does it make? You know, that's the piece that bothered me. Now, I was just wondering, you know, how other states are faring out. Are the legislators a little bit more sensible and reasonable along with their governor than we are in this state? We know we have money problems, but it seems to me if you talk about the research, and we're going to talk about the research centers, but the kinds of information that your organization, the March of Dimes, are providing to us, and other such organizations providing, it seems to me that independently you are doing research and you are really doing the logarithms, if you will, and determining factors. And it seems like when you come in, you're telling me these are the numbers, and that's your research. No one gave it to you. But then I get, you know, still Zarkon come in for the Advocates of Children, and they tell me these are our numbers. And I said, wait a minute, that's the same number that March of Dimes gave me. And then I get another group come in, I said, hold it. All this independent research is coming up with the same issues, some of the same elements that need to be addressed to resolve the problems. So why are we not paying attention? And that's why I'm concerned, you know, about this. Our kids are failing in school. And we think that the kids just don't want to learn. We say the teachers can't teach. But no one is looking at the fact that maybe the child is not learning because of these issues that you're talking about that need to be addressed. Lead in the water, you know, the environment they're living in, not being fed properly. And it takes money to address it. And as soon as we set money, the politicians tell the communities, nope, we're not spending more money. They get more than anybody else now, whoever they are. That's a pronoun that's used. We know what it means. And it bothers me. So I'm glad you're doing what you're doing. The research centers, you have several research centers, is that correct?
Yes.
Can you talk about them and where they're located and the kinds of things they're doing?
Yeah, absolutely. So the March of Dimes over the last few years has put together what we call our transdisciplinary research centers, and it's all prematurity research. So there are 5 of them now. And it's what we call team science. So they're bringing together numerous different researchers in many different fields so that they can work together to try to solve the same problem. So it's not just people who work in biological sciences, it's people who work in public health, it's people who work in economics, it's all of these different things that we're able to bring together to try to figure out how we solve the problem of prematurity. So there's one, the Ohio Collaborative is one that's working on that biological difference in different races. There's one in Stanford, and the Stanford one actually has published research already on differences in what they call the microbiome. So it's the living organisms that are within our body, and those differences in microbiomes can affect whether or not you have a preterm birth. So they're finding positive results already. There is one at Washington University, one at the University of Pennsylvania, and then one at University of Chicago, Northwestern, and Duke is combined together. And we're lucky in New Jersey, we have a scientist and researcher that's located at Princeton that's involved in some of this research. So we're already seeing ourselves kind of getting our feet into the research that's happening.
Is there a need for New Jersey to come up with the same type of collaboratives? Here you say you have a person involved, but that's not saying you have a team. Is there a need? Because, we just merged all these institutions, and I'm very adamant about what they're doing and how they're going to do it. One of the best institutions around has always been a University of Medicine Dentistry, top-notch international professors there and researchers, etc. But we destroy the institution playing politics. It's still a good institution. And then we have Rutgers. We can say a lot of things about Rutgers, which I can say a lot of things about Rutgers, and how they waste money. They really do. And some of the abuse stuff that go unchecked. But in reality, when you look at the kinds of professionalism there and expertise is there, along with the Princetons, etc. So it seems to me when you look at the Robert Wood Johnsons, you have the same thing. When you look at the Barnabas and some of the other healthcare facilities, or even though we talk about the lack of funding for healthcare, not having enough money to maybe keep the facilities open, we need to pay attention to the kind of talent we have and say, okay, while we are open and you're here, can we come to the table? Is that being worked on by anyone, or do you think that maybe we should promulgate some legislation to compel that collaboration, like Ohio or Washington State? I mean, give me your thoughts on that, because I have no problem putting a bill in and pushing it. Yeah.
So, and that sounds good to me. I mean, the more research, the better with this, because we really don't understand why we're having these problems. So the research centers that we do have are pretty large-scale collaboratives. If we could put something like that together in New Jersey, it takes a lot of funding to make this research happen. It's multi-million-dollar projects that they're putting together in terms of the resources that they need and all the different machines that they're using in their labs and all of this. It would be great to see more people coming together to do this collaborative research.
Well, you have people with money and you have people committed to it. The same folk who are spending money to privatize education and control our destiny, maybe we should convince them stop trying to control our destiny, use that same money put into the research, and we'll take care of the destiny part, because we'll have healthy babies, okay, and they'll learn better. Teachers can teach, so we know that. Can you make certain that the Legislative Black Caucus, through me, get a copy of the best practices or collaboratives, or maybe the different ones, but kind of point out, and we can have some more conversation, kind of point out as to what we should be looking at and what we should maybe be encouraging by way of legislation in this state, so that we can continue to be a part of as well as compete, because the state is always talking about competing with other states and how well other states are doing. The attitude is fine, let's put our money where our mouths are. You want to be a part of that, you want to compete there, then it's going to cost you some money that you claim you don't have, okay, but I know you can get it. Because everything does not have to come from state government. When you start to talk about research, you're talking about people and entities that provide grants to you. And we have enough people here that can write good grant programs, because they've shown they could do it already. And by having someone at Princeton already involved, I think it makes the conversation a lot easier, because people like that can testify before a committee and educate us in the legislature why it is important. And then we can do all we can to get the institutions who are out there searching for grants anyway to say, look, there are grants that you guys can get. You can't get it for your university, but you can get them for collaboratives. See, and I think people miss the boat sometimes, that there are dollars that I can't get, but you can get to use for what I want. And so we need that. And so if you could do that, I really would appreciate it, and I'm sure the members of the Legislative Black Caucus would appreciate it too. Can you talk about some of the programs and services, some of the main programs and services the March of Dimes are providing here in New Jersey? And you may want to talk about some of the ones you may be aware of that does not being provided, but being provided elsewhere.
Yeah, okay. So this is something that I get really excited about, is our Healthy Babies Are Worth the Wait program.
Get excited.
So the history of this program is, it started in Kentucky. And a few years back, they started talking about what can we do to help to decrease our prematurity rates, and to really help women understand that a full-term baby is, of 37 to 40 weeks is what we consider a full-term baby. And so they collaborated with Johnson & Johnson and with the Kentucky Department of Health and the March of Dimes. They all came together and started working on this program. And they saw this decrease in preterm birth rates as they were working on it. And so what they did was they asked Texas and New Jersey to do the program next, because they said not every community looks like the community in Kentucky. So they wanted to see what we can do in different communities. And so what Healthy Babies Are Worth the Wait does is it combines education of the community with education of providers, with programs that we're putting on, with research that we're doing to really all come together to help make a difference. And so the program in New Jersey started in Greater Newark. And so we've been working in the Newark community for about 4 years. And we have worked with hospital partners, with federally qualified health clinics, with home visiting nurses, with a huge variety of different community members in Newark. We have an advisory board that brings a whole bunch of different players to the table to talk about what the needs are, how we can reach different populations. We have started doing group prenatal health care at some of the local medical providers. That is really helping to bring pregnant women together and help them form, like I said before, this community mentality. So they're leaning on each other and helping to support each other through their pregnancy to have the most positive outcomes. We took that program that we've been doing here, and now we have started that program in Burlington County. So we've put the advisory board together. We're working to see what kinds of programs are going to work for them. The problems that we see in Newark are different from the problems that we see in Burlington County. So we're really trying to see what we can do in both of those communities to help bring these numbers of premature babies down and increase the amount of positive birth outcomes.
Do you have a list of the geographically Burlington County, county by county, and maybe municipality by municipality, but at least county by county? For example, we know that, and I know that Assemblyman Telefaro is very much concerned, as is Assemblyman Singleton Conaway, who's happened to be a doctor, by the way, in that whole South Jersey area. But I know that Burlington County and Salem County are some of the poorest counties, if not the poorest counties, in the state of New Jersey. And it'll be interesting because there's also a lot of open space there. So it'll be interesting to kind of see what, on a ratio-based, percentage basis, what the premature births and things look like. Because you would think if it's a poor community, that more than likely you're going to have some high numbers there. And you know that cities like Newark or Camden are very dense, so you have expectations there. So it'd be interesting to see where they play. And geographically, where is that? Is it just as high in the majority of the rural community in Salem County as it is in the city, which is small, okay? If you have that information, could you share with us? Because we need to be educating my colleagues in the legislature as well, and those in the administration that may not be paying attention. And we know that, as I said, a program that we had in the past when we was talking with the Black Issues Convention and others, that everybody in New Jersey want to be the governor and the rest want to be president. And so maybe it's the right time to have these things talked about, because if we have to make decisions, particularly those of us in the Black community, other communities too, but the Black communities, because we never get spoken to till the last minute, they need the icing on the cake, if you will. We want to be in the front of the conversation and say, look, this is what we support, this is our expectation. These are the policies that's going to drive our politics. And I think that's important. So if you can share the information with us, county by county, I would like to look at that, and I would like to be able to share it with my colleagues in the Legislative Black Caucus and also my colleagues in the legislature as a whole, because, like I said, they'll be very much concerned. They'll also probably be concerned in some of the areas of wealth, to realize there's more prematurity than they think it is. I think it get covered up primarily because a lot of times when you have wealth, you have folks that can maybe not fix the problem, but can cater to the problem and take care of the problem and still live a normal life and maintain those babies as well, because the dollars are there, rather than putting them in some type of institution to maintain them and just visit, things of that magnitude. So if you could do that, I really appreciate it. What are some of the other services the March of Dimes offer? Are there any services that are different in New Jersey versus other states that you're involved with?
Well, Healthy Babies is a huge one because there are very few states that are running this program right now.
Okay.
So it's one of the things that we're really proud of that we're able to bring to the table. One of the other things is our NICU family support program. So the NICUs, for those people who don't know, are the neonatal intensive care units. So for any premature baby, any child that's born with a birth defect, or any concerning health issues, they're brought to their NICU in the hospital. And what our NICU Family Support Program does is it has a family support staff person in the hospital. Our program is at Capital Health, which is in Pennington. And this NICU family support person helps to work with the families to tell them how to best care for their baby, to get rid of the misconceptions of you can't hold your premature baby or you can't breastfeed your premature baby, to help them to learn their best practices, and to also help to continue to educate the practitioners there, the doctors and the nurses, on all the new things that are coming out. So we have that program there. The program is also replicated at Valley and at Newark Beth Israel. So they have different components of these programs, and those are throughout different states in the country as well. We have these programs to really help support some of the families. We also have digital resources. So we have a website that's called Share Your Story. And so this is one of the things that is really important for people who have had an experience with premature birth or with losing a child, to see other people's stories and to be able to share their own. That support is really helpful in the healing process for families who have experienced this, because it's very emotionally taxing on a family to have a premature baby, especially in a community where you're thinking, I can't afford this. I don't know what to do. I don't know who to talk to. So Share Your Story is a website that we have that families can go and share, and to read that other people have been in the same situation and what they did. So those are some of the things that we do. And you also mentioned grants. So we write grants. We try to get money from as many different places as possible to help spread our services. We want to reach every corner of the state as best as we possibly can. We have grant funding that we give. So organizations can come to us and write grants through us to help and promote their programs. So we're really working to expand our reach to touch all the parts of New Jersey that need it.
Well, there's a lot of need. I can assure you that the Members of the Legislative Black Caucus, we represent those needed districts probably more so than anyone else. If you talk about Salem, Burlington, if you talk about Camden, if you talk about even the Willenburg area, when you start to talk about the Pattersons, you talk about the Passaics, the Plainfields, you talk about the Jersey Cities, the Oranges, the needs are there, and I know you can't spread yourself thin, but what's amazing as I talk to you and the work that you're doing and the work that you, meaning the organization, as well as yourself, and the partnerships. We need to talk about the partnerships, but the March of Dimes is not getting the kind of credit that I believe they should be getting. I know that the March of Dimes is not looking for credit seeking and all that kind of stuff, but it's amazing me as to I'll be interacting with Beth Israel in Newark board meeting or advisory board meeting, I think in a week or two. They never talk about, well, we got this data here and the March of Dimes provide this data and here's what we're doing, okay? They just tell us they have it, and if they tell us it's 1 in 10 or 1 in 8 or what have you. I think that you need to do a better job, excuse me, of letting people know what you're doing, because I think it's very important for the organization to get the kind of support that you deserve, number one, but that you used to reach out for when you were doing little things in the stores, put the little 10 cents in. But so people know that it is a worthy cause to give to when they do see March of Dimes reaching out for that kind of help. But you also talked about partnerships. You talked about the advisory board. I did not realize you were doing so much in a city like Newark. We just don't hear March of Dimes. And you was working with so many people that I interact with on a daily basis as an elected official who never mentioned March of Dimes. And I'm going to tell them to stop getting glory and share some of that glory they're getting about the March of Dimes. But who are your partners on the advisory board, and who are your partners in general you work with to get your work done and to get your programs implemented?
So we work with a ton of different places. So I do site team meetings once a month with Newark Beth Israel, with University Hospital, and with the Newark Community Health Centers. So those are 3 of our main partners. We've provided them with grant funding to help run their parts of the Healthy Babies Are Worth the Wait program. So they're doing group prenatal care at their sites. They're helping track numbers of how many women are coming in the first trimester of their pregnancy, how many women are coming back after birth for their postpartum visit. So we work with those partners very frequently. At our advisory board meeting, we have evaluators. So we had an evaluator that worked through Rutgers University that helped to track all of our progress. We have different home visiting organizations like the Leaguers that come to our meetings. I work with the Essex County Home Visiting Advisory Board. I go to their meetings to see what are they doing, tell me about the families that they're working with. We work with the Partnership for Maternal and Child Health for Northern New Jersey for our NORC programs. We work with the other maternal and child health consortia with many of our other projects. And we work just with anyone that we could possibly bring to the table, the Newark Department of Health. Any meeting that we get invited to, we want to go to. We want to be there and say, we're here to be supportive. And it's for Newark specifically for our Healthy Babies Are Worth the Wait, but really in a broader sense as well. We go to the Infant and Child Health Committee meetings that the state holds. In Burlington County, like I said, we started our Healthy Babies Are Worth the Wait program there, so we're working with the different hospitals that are in South Jersey and working with doctors and medical providers, and it's really it's a team effort, so we have to work with as many people as we can.
So you work with a lot of docs and professional people, and you talk about professional education and the kinds of things you're doing as relate to the healthy babies and worth the wait. Can you talk more about that that education component and the kinds of topics that you really kind of geared towards in terms of your instruction or if you will your education or what have you?
Yeah, so we really look at anything that we consider to be a risk factor for a poor birth outcome. So last week we had two fabulous speakers that went to Virtual Memorial Hospital and also to University Hospital and talked about trauma-informed care. So if someone has experienced domestic or sexual violence, they may have different healthcare needs and it may affect them during pregnancy differently. So we talked about how that affects a woman's health and what providers can do to be more sensitive to the care that they need to give these women. We talk about things like neonatal abstinence syndrome. So if a mother has been using prescription or non-prescription opioids or has been getting a treatment like a methadone treatment, their child has a chance of experiencing withdrawals when they're born, which is what we call neonatal abstinence syndrome. So working with doctors to say, how do we treat these children? How do we treat these families? And what can we do to help improve their outcomes? And also things like early elective deliveries. So New Jersey's done a great job of kind of stopping these deliveries. So somebody saying to a woman, okay, you're gonna have your baby on this day and we're gonna schedule it and that's gonna be it. Well, there's a big difference between a baby's development at 37 weeks and a baby's development at 39 weeks. So we've really been helping to educate providers on the importance of waiting.
But and that's a good thing too. As I listened to you in the education piece, going back to the university status, when we did the merger and splitting up of everything, a lot of the components of University Hospital, which was UMDNJ, it now rests as a responsibility of Rutgers University, the allied health and things like that. Is Rutgers University, Newark University, Camden, are they part of your network in terms of the March of Dimes and what you're doing?
So Rutgers now, as they've taken over the UMDNJ, is now our partner there. So they are kind of the higher body that helps to make sure that the clinic is still getting the funding that it needs by providing the grants and making sure that we still have continued that partnership. So our partnership there has continued even with that change there. At the other locations, we work with them on a variety of different projects, and we have since before this merger here. So we are partnering with them in terms of helping to get some research done and working with them in that way.
Anything happening at Rutgers, New Brunswick, not New Brunswick, but Rutgers, Camden, and their relationship in Camden City, which is politically controlled like crazy, but a lot of healthcare needs down there that folk claim they're working on from Cooper University. But that's wonderful, but there are other needs there too that need to be worked on from a healthcare perspective. It just can't be Cooper and politics. It has to be other things. Is the March of Dime involved in Camden at all?
So we're looking to get more involved in Camden.
Okay.
So we just provided a grant for group prenatal care to be done in Camden City. So that's one of the first things, is we're helping to get some more money into that area to help with the things that are important to us. We're doing a Grand Rounds presentation at Cooper with their providers to help talk about some of the risk factors of preterm birth. And we're hoping that we can expand our programs further, like I said, to reach into these communities that we haven't been able to get our hands in before. And the big thing with the March of Dimes is we're a small staff, and so what we need to do is really get the community partners engaged to be able to have them help provide the services and filter our research and resources through them to their communities.
Is there a clergy partnership or clergy relationship throughout the state in terms of educating the parishioners, in terms of educating the clergy, in terms of getting them more involved, if it's no more than just sharing information with their congregations and the communities in which they're actually represented with their churches?
So in my experience, there hasn't been a very strong partnership with the March of Dimes with a lot of the clergy. Some of our partners, specifically in South Jersey, have a lot of good relationships with religious partners down there. They share resources. Some of the churches allow their groups to use their facilities to do some educational programs. So there definitely is good partnership when it comes to maternal and child health with religious groups. But I don't think we have as strong of a relationship as we should with some of these partners.
Have you thought about the kind of relationships that you believe you should have with clergy partners, particularly in the African American community? Something that maybe Legislative Black Caucus can help you with, because we do have a strong relationship with over 300 clergy members from South Jersey, North, East, and West. And we have a subcommittee on the Legislative Black Caucus that's chaired by Assemblyman Benji Wembley, who oversees that committee, the Faith-Based and Cultural Affairs Committee, and maybe there's a need for me to get you with the Assemblyman and maybe get information to our clergy members, and maybe even call some meetings where you can come in and talk, because I think it's very important that your network, any network in New Jersey that's providing services and research and looking at the black communities, there's no way they can do all that need to be done without having a partnership with the black clergy. And I think that's important. And in our congregations, we do have people like yourself with Master of Public Health degrees. We have physicians. We have, so I think it's worthy. So if you can go back and make a note and talk to your network about what kind of relationships and the kinds of things you think should be involved with working with the clergy, and in our case, quote unquote, the black clergy, and get back to me, I will set a meeting up and give a charge to Assemblyman Wembley as to how to work with you and how we can do that. So that's on you to get back to me with that, okay? And I'll ask my staff, because I know they're paying attention, to make a note to remind me to have this discussion about the March of Dimes with Assemblyman Ben Wembley sometime this week when I speak to him. With that being said, we've covered a lot of stuff, and you've talked about a lot of different programs and a lot of involvement. But the one thing I've learned in life, that we can be very gratuitous when we want to be, and we can do a lot of pro bono, which is another term for being gratuitous, and we can do the best we can. But at the end of the day, almost any and everything we do, regardless of what our economic position is in life, still requires some money. So with all these things, how are you funded?
So the March of Dimes is lucky in that we allocate 76 cents of every dollar to all our programs and services and research. So the majority of the money that we're raising through our fundraising efforts, which people see, you talked about donating a dime. Well, a dime goes a long way to adding up to being $1 or to being $50 or $100.
Right.
So we do lots of fundraising activities, and that money helps to fund what we do. So fundraising individually, working with families at our March for Babies walks, working with big companies and organizations within the state that have a vested interest in health. Any company that has female employees, they're covering health insurance. They're helping to pay for the birth of the children that these women may choose to have. So understanding that having a full-term healthy pregnancy is going to save them hundreds of thousands of dollars over the years. So really getting people to understand that, they invest in the March of Dimes to help to do the research that they do, to do the programs that they do.
It's very interesting. You mentioned something. This is the time of the year, and many of our family members have had a bout with cancer, if you will, and they're a cancer survivor. In fact, my stepmother is a cancer survivor, and she's 89 years old. And we have the walks for cancer, etc. But the March of Dimes have a walk for babies. Could you talk more about the walks for babies? Because we don't hear as much about the walks for babies as we hear about the walks for cancer victims and patients and people of that magnitude.
So the March of Dimes does March for Babies. So we have 14 locations in New Jersey alone. It's the nation's first walk. So we're the first people to really put this together and get people moving on their feet. And it brings together families and organizations who have had experiences with prematurity and infant loss. And they walk for approximately 3 to 5 miles, depending on what the site is. And it really, you celebrate all of the strides that we've made. You celebrate hope and all of these families that have had these experiences. It just gives them a chance to bring their experiences out into the open. And so it's a really great way that we've been able to make that connection.
What is the role of advocacy in the March of Dimes?
So the March of Dimes works largely in Washington, D.C. We have a federal team of advocates. And then in each state, in every state capital, we do work. So year after year, we're working to help secure funding for newborn screening, to help with increasing knowledge around things like neonatal abstinence syndrome, around the effects of smoking on a pregnancy. So all of these different things, any legislation that'll help improve the health of women and children, and we get behind those things and help push them forward.
Very good. I think we're going to have to wrap up now, and I want to thank you very much for coming on our program. I'm hoping that our viewers, really absorb this information and get a lot from it. Please share with your family and neighbors. Get involved in March of Dimes, and tune in again next week to this program. New Jersey Legislative Black Caucus from Trenton to you. Have a good evening.